primary endpoint in the phase 3 double-masked study for Cequa was that proportion of eyes that had a clinically meaningful improvement at day 84 in the unanesthetized Schirmer scores. So clinically meaningful improvement in Schirmer scores was defined as an increase of 10 millimeters or greater from baseline. And this was met. Randomized patients receiving Cequa demonstrated statistically significant improvements in their Schirmer scores when compared with the vehicle group. It was 16.6% of eyes receiving Cequa who received a 10 millimeter or more increase in their Schirmers from a baseline versus only 9.2% of those receiving vehicle. In any study of eye drops, there are going to be occasional issues with tolerability, and typically this manifests as mild stinging and burning, and indeed this was seen in the Cequa study. 24.2% of patients with Cequa and 4.3% of patients with vehicle had symptoms, but more than 95% of the patients described their symptoms as none or mild burning and stinging, and only 4% of patients taking Cequa reported either moderate or severe stinging or burning. And this is kind of also shown in the discontinuation rate for Cequa in the study, which was 3.2% and 1.1% for the vehicle group. There were some non-ocular side effects that were also noted by a small number. That was 1.6% or less for either of these treatment groups, and those included headache, sinusitis, and urinary tract infection. Thankfully, there were no serious adverse events that were noted related to study treatment. Clinically relevant slit lamp findings were also noted in a very few patients. It was 1.6% with Cequa and 0.3% in the vehicle group. The primary finding that was noted was hyperemia of one or both eyes. There were no visual acuity changes that were clinically significant in either treatment group, and no issues with intraocular pressure in either group in the study. There were a number of things about the study that really impressed me about Cequa. First, in just 28 days, we saw clinically significant clearing of central corneal staining. And second, by the study's conclusion, we had 65% of patients who completely cleared all central corneal staining. Lastly, patients stayed on the drug almost 97% of the time. The discontinuation rate with Cequa was 3.2%, and it was 1.1% for vehicle. So for me, this means this is a drug that I can give my patient. It's going to work fairly quickly, and they're going to stay on it. We also have minimal blurring of vision when Cequa is used because it's a clear aqueous solution rather than an oil and water emulsion. So as with any medication, we have to warn patients about a few precautions. We certainly should not put Cequa in while a patient is wearing contact lenses. And we certainly advise patients that if contact lenses are worn, they probably ought to be taken out of the eye before administering the drops and then not put in for another 15 minutes after the drop is administered to the eye. The secondary endpoint in the study included the mean change from baseline in Schirmer test scores, total conjunctival lissamine staining, central corneal fluorescein staining, and complete clearing of central corneal staining, as well as clearing of temporal conjunctival staining and global patient-reported symptom scores. So at day 28, clinically significant improvements were seen in the Cequa group as compared with the vehicle group for reduced total corneal fluorescein staining, reduced central corneal fluorescein staining, a greater percentage of eyes with complete clearing of central corneal staining. That means a staining score of 0. So this trend continued with added improvements in Cequa patients at day 56 and then at day 84. There was a reduced total and central corneal fluorescein stain found again, greater percentage of eyes that experienced complete clearing of the central cornea, and a significantly greater improvement in total conjunctival lissamine staining of the Cequa group as compared to the vehicle group. For my colleagues who haven't tried Cequa, I would suggest try it. You're going to be impressed with how tolerable this medication is for a cyclosporine compound and how well it clears the ocular surface for patients. For me, this is particularly important for patients who are headed to cataract surgery who have dry eye, because they're very common, these patients, and the result they end up with, they give me credit or they blame me for, depending on how severe their dry eye is. And so it's very important that we get that dry eye under control before surgery. Cequa allows me to treat that dry eye effectively, quickly, and with a formulation that's very tolerable to patients.